Hello and welcome to our COVID-19 update studio. I'm Neota Igbe. Here are the highlights of the program tonight. Edo State Education Ministry trains head teachers and principals ahead of school resumption on Monday. Taraba State government warns residents not to stop observing safety protocols at the state, as the state gives no case to fatality report. In the United Kingdom, more than 6,000 COVID-19 cases recorded in the past 24 hours. Edo State plans to reopen its primary and secondary schools on Monday, the 28th of September 2020. The state government, following the directive of the federal government and with its support, has commenced the training of head teachers and principals in public schools on COVID-19 protocols, as well as measures that would aid them in ensuring that the protocols are followed strictly upon resumption. The state government also said to have provided face masks for all teachers in the state and would ensure the provision of water and soap for hand washing in the schools, as well as cleaning of all schools before Monday.
Empty and quiet, the features here at Payne Primary School in Benin City, the Edo State capital, similar to that in other schools in the state for about 6 months while the coronavirus pandemic raged. These head teachers and principals in the state are meeting in this hall at Imagwero College, also in Benin City, ahead of a training on COVID-19 protocols in preparation for resumption on Monday.
To welcome
a team from the Health and Education Ministries, as well as the Universal Basic Education Commission, informed the gathering about the goals of the exercise.
Prepare your brain to take in the additional idea to create a safe learning environment in schools. We have been told that from time to time, people will be coming to monitor, to ensure quality in the delivery of our service.
We still have our isolation centers still functioning. We still have our molecular laboratories still in place, both public and even private, running in Edo State, and services are still going on in these areas. All we require is just that call.
The authorities maintain that private schools are not excluded from the preparation.
We met with the private school owners before now. Yesterday we had a meeting with them and we have already let them know what to expect of every school. We had a training before now, before they started the WAEC exams, and I believe that all of us are going to comply with the NCDC guidelines of school reopening.
Another important group of stakeholders are the parents and guardians.
Beginning this week, there is sensitization across the state in various communities to alert parents to the fact that school is resuming and to also educate them on what they need to also do to ensure that we don't have a spike in infection rate for COVID-19.
The training session commences immediately with the participants placed in different classrooms where interaction follows. The workshop, which is to run for 5 days across the 3 senatorial districts of the state, is just one of the strategies the state is adopting to ensure school heads adhere strictly to COVID-19 protocols on resumption of school. Others include operating a schedule where GSS 1 to 3 students are in school between 8 a.m. and 11 a.m., SS 1 to 3 students from noon to 3 p.m., while primary schools would run the normal schedule of 8 a.m. to 2 p.m. Jessica Olubuse, Channels Television News.
And in Enugu State, the government has set September the 28th as the day that the primary and secondary schools will open for the third term. While they're preparing to open, the government is asking teachers and pupils and heads of schools to ensure that they abide by the approved guidelines of COVID-19, and no person is to be allowed into any school without appropriate face masks or shield and hand-washing equipment or sanitizers. The government is putting together strong monitoring teams at state and local government areas that have been constituted to monitor compliance with their approved guidelines for the safety of operations in the schools. The primary 6 and junior secondary Secondary 3 students that have completed the examinations and are not expected to be back within the school premises. And the president is asking the United Nations to ensure accelerated development, manufacturing and uninhibited supply of safe and effective coronavirus vaccines to all parts of the world. In his address to the 75th United Nations General Assembly holding virtually, President Muhammadu Buhari pledged that Nigeria will partner with the UN and some other countries to achieve the target on COVID-19 vaccine. He also emphasized the need to jointly and fight the scourge of poverty, particularly in developing countries, disarmament and terrorism, climate change, human rights abuse, corruption. The president called for inclusion and collective action as members of the international community, insisting that Africa deserved a permanent seat in the UN Security Council.
The international community will need to cooperate in addressing the scourge of poverty, particularly in developing countries. It is in this regard that we commend the President of the 74th General Assembly for launching an alliance for poverty eradication in June. We encourage global leaders, particularly leaders from the global north, to support the alliance at this time when the coronavirus pandemic is reversing gains made in the achievement of the 2030 Sustainable Development Goals and pushing an additional 500 million people into extreme poverty.
The President of the Federal Republic of Nigeria, Muhammadu Buhari. Now, the Lagos State government has received a donation of palliative packs to be distributed to the less privileged in the state. The state coordinator of the Coalition Against COVID-19, Mr. Amechi Okobi, commended the government for its efforts in managing the pandemic within the state and also appealed to the governor to ensure that the palliatives get to those in need of support. Speaking on behalf of the state government, the Acting Commissioner for Agriculture, Abisola Olusonya, said the items will be distributed through the local government's representatives.
The idea here is to take care of our fellow man. 1,666,667 Nigerians need our help. All Nigerians could use our help, but we focused on the lowest 5% to ensure that in these extremely tough times, they're at least fed. We had lockdowns that prevented them from working, so this helps. Could we do more? We would love to. Could you do more? I know you would love to. But this is a start. It just basically says Nigerians for Nigeria are fighting this fight. Mr. Governor, the road is long and hard. The efforts to get this food and palliatives is gigantic. But to distribute this food is even more because we know all the problems we would face. So, Mr. Governor, our ask on behalf of CACOVID is that you continue to support to help us ensure that every last Nigerian that the Commissioner mentioned gets these items.
According to the COVID team, Lagos State is supposed to receive 107,546 beneficiary packs for our citizens, for the indigent, for the elderly, for those that do not have the wherewithal or the capacity to have food on their table on a daily basis. Now, for this 107,546 beneficiary packs, each pack contains 10 kilograms of rice, 5 kilograms of gari, 5 kilograms of sugar, 1 kilogram of salt, 2 cartons of noodles, Indomie, and 1 carton of pasta.
Amidst the rising level of non-compliance, the Ekiti State COVID-19 Task Force wants the residents to take responsibility in checking the spread of the virus. The coordinator of the task force, Professor Bolaji Aluko, says it will be risky for people to assume that COVID-19 has faded away or would fade away with time, insisting that prevention is golden. He observed that residents of the state in recent times have been downplaying the use of face masks, disregarding physical distancing and regular hand washing, amongst other prescribed protocols, condemning the noticeable lapses and asking citizens to take responsibility. Now, with states ramping up efforts to meet the testing targets, over 3,000 COVID-19 tests have been carried out in Nasarawa State, most of which were taken to the NCDC laboratory in Abuja. But now the state started testing, and there are plans to scale up capacity in the coming days to halt community spread. Our correspondent Halima Gayam also reports that the government is considering home care for those who meet the requirements.
As the Nasarawa State government sets to increase its testing capacity, the target is to get to the locals to minimize community spread of the virus.
The state government is acquiring a mobile testing machine. It's a vehicle that will be going around to do mobile testing. And once that comes, we hope that we'll be able to do a lot more random testing to see that our state is completely will cover the state and we're in control of whatever is happening within the state.
Not oblivious of the fact that once testing is increased, there would be more discoveries. It is already considering other forms of isolation and treatment.
We have improved from isolating them in isolation centers to now even home care. Once we diagnose a patient as positive, we look at their homes and see if they can manage at home. And so far, we've done quite a number of cases that we've been managing at home, and they've been quite positive. The results have been quite positive. So for a person who tests positive, is more comfortable in his own environment than another environment, even though we try to make our isolation centers as comfortable as possible, because if you go to check the isolation centers we have and treatment centers we have here in Lafayette, all the rooms are air-conditioned, and there are television sets there with satellite TVs and stuff like that.
Confirmed cases of the coronavirus in the state is standing below 500 despite its proximity to the Federal Capital Territory, Abuja, which has over 5,000 confirmed cases. The government say it is not relenting in fighting the pandemic. Halima Gayam for COVID-19 update.
Let's go to Bauchi State, where the government is injecting 2.5 billion naira loan service to the health sector to resolve the numerous perennial challenges bedeviling it. Governor Bala Mohammed told members of the Nigeria Medical Association Bauchi branch when he received them on a courtesy visit. The president of the association, Dr. Damu Sambo, listed a number of challenges in the middle of the pandemic to include manpower shortage, poor welfare, infrastructure decay, inadequate working equipment, and others.
There's no how you bring a doctor for housemanship without a place to sleep. There is no how you cannot provide a medical quarters in a hospital and you expect to get a doctor on call. So all these gaps are there, and that's why we are declaring a state of emergency, and we are calling for a health summit to discuss all these challenges. We have taken inventory of all this, done the due diligence. At the end of the day, we will sit down. This is our capital requirement, equipment, personnel, and of course, this is the cost. This is what the state government can provide. We have leverage on the federal government incentivization, where we take loan at a single digit. We have already accessed 2.5 billion just for medical and health sector.
And it's the next phase of campaign against COVID-19. In Taraba State, Governor Darius Ishaku says his administration will continuously expand testing and treatment facilities. He said this when the technical team paid him a visit. But beyond the technical team visiting the governor in Taraba State, there's also that concern of those who are living in confined spaces like the prisons. For instance, more than 11 million people are in custody worldwide. More and more people, 30 million people entering and leaving detention every year. The threat of COVID-19 for these people in prison is very real. In the vast majority of the world's overcrowded and underfunded prisons and detention centers, physical distancing is simply not an option. In situations where close confinement, shared facilities and spaces and poor hygiene are commonplace, inmates and prison staff are living in constant fear of the ticking COVID-19 time bomb. What's the situation like in Nigeria? We're now being joined on this program by a public health physician, Dr. Ganiu Jamiu. Dr. Jamiu, thank you for joining us.
Thank you. You're welcome.
Let's start out with this idea and compare the two things. While schools are opening up around the country gradually, whether in phases or not, but they are opening up gradually. But then you also have the prisons that, of course, they are not opening up. And the people in the prisons are all living in confined spaces. Do you think even their welfare is taken into cognizance, especially in the face of the pandemic?
Well, I won't want to say whether their welfare is being taken care of, but even before now, the people in prison constitute one of the vulnerable set of people, in the sense that looking at the nature of the prisons, the spaces are so limited. Issue of overcrowding, which prone them to respiratory diseases like tuberculosis even before now. Apart from that, these are people that, because of lack of adequate spaces, you find that they just, they sleep in a congested cells. Even before now, it has been said that our prisons are so congested. That also poses a risk. Apart from on the upper respiratory tract before now, we have the issue of skin diseases and so on. And with this COVID-19, it makes matter worse. In the sense that these are people that are, as I've said, vulnerable. They are not being provided with basic like face masks, soap, and washing materials, as well as the issue of social distancing is actually a big of challenge. And apart from that, if you also look at it, you find that they also pose a risk. The people working with them, the staffs that normally go home and come back, also pose a risk to them. Visitors pose a risk to them. And even when they are being taken to court to face their trial, they also, being exposed to risks from the community. I think just like the usual way, the only thing I will advise the government to do is to see what measures that can be put in place to prevent a kind of, exporting or importing COVID-19 into the prisons. And there have been different measures at our with limited resources that have been done. Like, for instance, I will advise, I don't know, if there can be provision, maybe some cells can be designated as medical isolation centers. And apart from that, there's also ensure that every new inmate that is coming are being quarantined in a special cell, just like what is being done in Western countries, so that they will not mix with those people that are already in the prison, so that they can observe for within the 14 days of the incubation period to see those people that will, show some signs and symptoms of the disease. And apart from that, it will also be advisable if even the workers that are coming in on a daily basis are being limited in number, so that the number of people that will be on one or two shifts can be reduced. And as they are coming in on a daily basis, there should be provision for verbal screening, as well as provision of thermometer, just to screen, to see those people that are, just to prevent, importation of COVID into the prison environment. And again, I will also advise, if there is a way, I know it may be a bit difficult, if this cloth face masks can be provided to the inmates, so that they can have the opportunity of washing some of those face masks. I know the issue of hygiene may not be, completely, resolved. But another thing I think they can also do is that any activity that has to do with contact, yes, like any activity that will involve inmates making contact, effort should be made to see that they are reduced, like sporting activities or any activity that will involve them coming together can also be, reduced to the minimal level. I think by
Mr. Jamiu, let me just stop you there for a second. You've reeled out a couple of things that should be or that can be done to ensure that those in confinement are taken care of, even in the face of the pandemic. But you know that before the COVID-19 situation came in, there have been that conversations about inadequate facilities, overcrowded halls, overcrowded prisons. The medical equipment there or the healthcare services there were not even up to par. But you're suggesting isolation cells, specialized cells, putting some of those who are coming in quarantine for a while for observation before they are allowed to go and mix with the other prisoners. Is there room enough for this? Or do you think there's an opportunity? Do you think there's an opportunity for the prison service to look and say, okay, these people are waiting trial. Okay, there's really nothing to do with these ones. We can let these ones go and all of that.
I think, well, based on what you just said, I think some state governors have been doing that. Some people that have maybe minor offenses or those people that be on pre-trial without being, trial, so some of them have been allowed to go. If we can discongest that, I think it will go a long way in actually reducing the possibility of spread of COVID-19. But I'm just saying, how about the fate of those people that are on trial or those people that are in jail? I think we need to make provision for that. That's why I'm just suggesting that. Because if you are waiting for isolation center to be built, that would be an Herculean task. So I think some of the cells, like in the foreign country, that's what we call cohorting. What do I mean by cohorting? Like, as I mentioned, those people that are just coming in, a designated cell can be set for them so that anybody coming in can be observed for 14 days, just a special cell. And for those people that effort should be made again, these people again, they are not being privileged to receive the kind of information every other person is receiving. So I think the prison service need to put their house in order, ensuring that adequate information are being passed to this set of people, and as well as ensuring, motivating them so that those people that show any sign or symptom of COVID-19 can come out so that such person can be, isolated, and if possible, if confirmed, that such kind of person can be medically isolated. But I agree with you that for those people that have minor offenses or have been there awaiting trial and without being tried, such people privilege can be given to such kind of people to be, to be discharged from that. But how many are they going to be? But even you go, as we are talking, I'm aware of the situation. I've been opportune to be in that place. Actually, the medical facility is not, I'm sorry to say, it's not nothing to write about. If you see a very small clinic with barely one doctor or three or nurses. But that I'm saying, the best approach is that they should designate some cells, like as I've said, for the newcomers. And for those people that are showing signs and symptoms, they can, put them in one particular cell. But the ultimate, I will advise, the best thing to do is just to prevent the importation of that, of the virus into the prisons by carrying out those measures, as I mentioned, that because even the staff, among the staff, there are risks because they go home and come back. So I am suggesting that they should reduce the number of staff that actually have contact with these inmates, as well as ensure that anytime they come into work, they are being screened, either verbally and thermal screening are being used to check their temperature. And again, advice should be given that any one of them that show any signs of symptoms should go for testing. And at the same time, there should be restriction of movement for visitors that come. And so the prevention is better than cure. It's even better it does not happen at all. Because if it happens, it may, I don't know, it will not be it's not something that can be imagined. Thank you very much.
Thank you very much. Dr. Gani Ujami is a public health physician who joined us via Skype from Bagada area of Lagos. Thank you so much.
Thank you very much.
And now we'll go straight to our Abuja studio where we have the Executive Director of Prisoners Rehabilitation and Welfare Action Power, Dr. Uju Agomo, joining us. Dr. Agomo, we thank you for joining us.
Thank you very much.
I'm sure you were listening to that conversation we were having with Dr. Jami, where he talked about designating certain cells, especially for those who are coming in so that they are observed. You think it's feasible?
I think the things he's been talking about are actually things that have already been done. I think following the COVID-19 and all that we're confronted with, the Nigerian Correctional Service began to take critical steps. As everybody knows, even up to now, access is strictly restricted. We also know that in terms of the staff coming in, there are basically the procedures that they have also put in place. Guidelines have been issued awareness materials, have been issued, and they are also using it both for staff and inmates. I'm also aware that some trainings also were conducted for the staff. I'm aware that in terms of the opening up, because first there was a situation where they then said you can't allow any inmate or any person getting to be detained, and they said that was the first, there was an embargo, but now that was opened up, and there are clear protocols, including the issue of quarantining, the issue of testing, and all that. So to the best of my knowledge, most of the things is said, if not all, are things I'm aware that are already being done. I think one of the things we have heard, I mean, even if yesterday during the anniversary of the 1-year anniversary of the Nigerian Correctional Service Act, the Controller General indeed indicated that they had no instance of COVID-19 infection, not, in all their facilities. And I think this is something that we should really commend the Correctional Service for, because as he said, you are correct, you understand how overcrowded some of our facilities are. I mean, you see facilities that have the official capacity of about 800, locking up to 4,000. So the whole notion of physical distancing is something that it's difficult to comply with. So I think, so the point I just want to make is that, to the best of my knowledge, I know that protocols have been put in place, and in short, all the things he has said, that as much as I heard him, seem to be be done. But you see, it has to be a continuous process. I think we can't say because we don't have an infection now, we should all do nothing more. But we need to just keep on. Countries like South Africa, for example, 50% of those who have infections in Kosovo are both 50% for the officers and about 50% for the inmates. So that's the point I needed to just say. But I think I agree with him. But the issue is that those things are being done, and perhaps that's why at the moment where the coast is still clear.
Okay, I know you said some of the things have already been done, but look at examples like the example in Ethiopia, where about 30,000 prisoners were released, more than 30,000 were released, and heightened sanitation measures were put in place. Do you see the fact that we haven't had any COVID-19 case in any of the prisons, according to the Nigeria Correctional Center? Do you think there's hope that nothing like that would happen?
No, I think we should just keep making sure that we're careful. I mean, I believe clearly that all the things that needs to be done should be done. I mean, for example, Prawa, we donated 50,000 face masks to the Nigerian Correctional Service with the support of OSIWA, Open Society Initiative for West Africa. They were donated face shields and some other facilities. We were also able to give, in terms of a pilot scheme, because remember that we are saying, if you say nobody should have access to these persons for obvious reasons, but you must also understand that they need contacts with their families, they need contacts with the lawyers, and that was why we also supported in terms of what we call virtual visits, computers and laptops, hoping that in a pilot facilities, not all the facilities, that is already about to cover about, I think, 17 centers, but I mean 15 and then 2 at the headquarters. So as a pilot, knowing that this can help them to be able to keep in touch rather than physically visiting the places of custody. So the issue is that there's a lot we still need to be doing. There have been a lot of advocacy that have been made in terms of looking at releases of those who don't need to be there so that we can reduce the burden, because as you know, the critical challenge is about this issue of physical distancing, because the population won't allow it. So if you look at the Nigerian Correctional Service Act 2019, if you look at section 12, from subsection 4 to 12, it gives us critical things that we can do to help reduce the number of persons who are in custody when that population is gone higher than the official capacity. We need to keep doing that, because that is a critical issue. There is no reason why petty offenders should still be in custody. Minor offenders, now we have community sanctions, community corrections, by virtue of both the Administration of Criminal Justice Act of 2015 and indeed Administration of Criminal Justice Law,
but do we
bylaw
have
of many states.
do we
And
have
of
the
course, the
facilities?
Nigerian Correctional Service.
Do we have the facilities to handle all of this? Because we do know that in March, the Presidential Committee for the Decongestion of the Correctional Centers started out a process about helping to decongest all of our prisons, basically. Do we have the facilities to move some of these people to the other areas you talked about?
No, the point I'm making here is there are mechanisms inbuilt that enables issues of ensuring that those who don't need to be in custody shouldn't be there. There are mechanisms that enables things like prerogative of mercy to review things, but it shouldn't be ad hoc. It should be sustainable. We are not doing as much as we ought to do. So we need to ensure that those who don't need to be in custody are not in custody. That is the problem. That is the problem. So if we do that, then we have a manageable number. So these are things that could enable us to continue to sustain the good sources. The sources we have now, that we don't have any person who is with infected in terms of the inmates. So, but we have to ensure that that record is continue to be kept. So we actually need to also commend the Correctional Service, since they have succeeded in doing this. So whatever they are doing that has worked so far, let them continue to do it. But we must also ensure that we control the population. That's the key thing. Controlling the population through a sustainable means. Now we have community correction facilities. So it's not everybody that you put in custody. So that is part of our problem, is that we are overusing custody. We are overusing imprisonment. It's not good for a country like ours.
Just before we let you go, there's a school of thought that believes that while we're also looking at the situation in the rest of the country, this is an opportunity for government to look at, one, the facilities, the health facilities within the correctional centers, and the welfare of the personnel and how they are taken care of. What do you think?
You're correct. I mean, I think COVID-19 is teaching us a whole lot of things that we need to begin to continue to address. And I must also say that during this process, there are guidelines that have been set up, both in terms of dealing with pandemic like this, in custodial facilities as well as in non-custodial facilities, that is in terms of community corrections. So it's necessary to have a holistic approach. The Nigerian Correctional Service needs to be supported to ensure that all that requires to be done in terms of upgrading the health facilities, in terms of the welfare of the staff, in terms of ensuring that all those processes that will enable these levels of support. I just gave you an example about virtual visit, but virtual visit is only in limited facilities that we've been able to donate this for as a pilot. But it's not only about the virtual visit, it's also about virtual court sittings, so that it's not in all cases that you have to begin to bring these people out. But as you said, you are correct in that regard. So a holistic approach must be taken to place. The full implementation of Section 23 of the Nigerian Correctional Service Act, which talks about healthcare, prevention of diseases, and all the rest of that. So just like we are doing and pushing and arguing that these things have to happen in the community, we also need to even push harder in terms of persons who are in places of detention or places of custody.
Thank you very much. Dr. Uju Agomo is Executive Director of Prisoners Rehabilitation and Welfare Action Power. Thank you for speaking with us this evening.
Thank you very much.
And let's go on to Taraba State. I spoke to you earlier about it. The state has no caseload of COVID-19, as well as no fatality recorded, which the governor attributes to early detection and adequate preparations made by his administration. But even though that is the situation right now, the government of Taraba says they will continue to expand testing and treatment facilities within the state.
June 2020, a day for the commissioning of a well-equipped 100-bed isolation center in Jalingo, the Taraba state capital, following the outbreak of coronavirus in the state. Since then, the state governor, Darius Ishaku, has been soliciting for assistance from all for the establishment of testing centers in the state to combat the virus. Today, members of the Technical Committee on COVID-19 gathered to give a scorecard of a no-case, no-death report in Taraba State.
The epicenter of number of cases is Jalingo, with 69 cases. Gasol 8 cases, Bukali 6, Takun 5, Valley 4, Donga 2, and Long 1. In cumulative, the total number of cases for Taraba State is 95 positive confirmed cases.
While appreciating those who have made the milestone a success, Governor Isheku urges all committee members to sustain the momentum.
I feel happy that we haven't lost anybody, and so it was worth the pains that we took. I will therefore encourage the committee that it's still work on progress. You cannot rest yet because we haven't gotten a vaccine yet. We're hoping, people are saying probably by December, January, we might be lucky. Am I correct, Doctor? So we are praying that if we can get vaccine before January, that will be fantastic. That will help us a lot. And at least that will reduce a lot more of the death that is happening all over the world, and particularly in Nigeria. I will be happy if the third testing point is being equipped as quickly as possible.
As members of the committee strive to keep the no caseload level, another task they've embarked on is the aggressive campaign on adherence to non-pharmaceutical safety gears and protocols to stop the spread of the virus.
While the Nigeria Center for Disease Control, NCDC, announced 176 new confirmed cases of COVID-19 reported in 13 states and the FCT. The latest data has Lagos having 73 new infections, Plateau 50, the FCT 17, Rivers 8, Ondo 6, Niger 5, Ogun 5. Edo State has 3 cases, Kaduna has 3, Oyo has 2, Bauchi has 1, Bayelsa 1, Delta 1, and Nasarawa 1. A total of 57,613 cases have been confirmed, while 48,836 discharged so far, and 1,100 deaths have been recorded across 36 states and the FCT. Now, the U.S. death toll from the coronavirus quietly surpassed 200,000 on Tuesday, less than 8 months after the first American fatality. U.S. reached 100,000 deaths in May. Now, some experts estimate the death toll could almost double by year's end. Fatigue for social distancing and the push to get back into offices and schools could fuel new cases and deaths in the coming weeks and months. The U.S. Senate called Dr. Anthony Fauci to testify on President Trump's response to the pandemic as the United States leads the world in COVID-19 cases. Our Washington correspondent Maria Bird has more.
The United States has now surpassed the 200,000 mark of deaths as a result of COVID-19. In a memorial of those who have lost their lives as a result of the virus, thousands of flags were placed in the ground on the National Mall.
And these flags are indicative not only of the lives lost, but of the families left behind and suffering. But this was preventable. Not all of it, but much of it. And what could be lost in the future is preventable too, if we embrace science. Science instead of politics.
On the same day that COVID-19 becomes the second leading cause of deaths in America, the President of the U.S. goes before the UN General Assembly and calls for the UN to hold China accountable for their actions related to the coronavirus.
We must hold accountable the nation which unleashed this plague onto the world, China. In the earliest days of the virus, China locked down travel domestically while allowing flights to leave China and infect the world. China condemned my travel ban on their country, even as they canceled domestic flights and locked citizens in their homes. The Chinese government and the World Health Organization, which is virtually controlled by China, falsely declared that there was no evidence of human-to-human transmission. Later, they falsely said people without symptoms would not spread the disease. The United Nations must hold China accountable for their actions.
while political parties are still divided over how to stop the pandemic. The virus impacts over 40,000 people in America each day. From Washington, Maria Bird, Channel Television News.
And now we're joined by our Washington correspondent, Maria Bird, to tell us what exactly the situation is like on the streets of Washington and the rest of the U.S. What's the mood of the citizens beyond the conversations from government to the presidents talking to the UN? But how are the people on the streets taking it?
Thank you for having me. And, you know, the people on the streets, I think at this point are becoming a little overwhelmed, to be quite honest. We're heading into the fall season. You're hearing of other countries preparing for a second round of the virus. We're still in the first phase of the virus. We still have not had many answers to how to curb the virus. You have children that are on school online, virtual schooling. You have parents protesting their children being virtually educated these days. You're seeing people still very afraid, not knowing what is next. You're now hearing they're entering the season that many have feared, the season that they say the virus thrives best in, which is the colder months in the United States. So they've been, you know, as you mentioned, 8 months since the first death. So people have been in this place for quite some time without many answers. So they're overwhelmed and concerned, and the economy continues to be hit as well. So it's an overwhelming time, I think, as you said, the mood. What is the mood? It's really a feeling of overwhelmment, I believe.
But this is about the season, as they say, the flu season, where people are taking flu shots, and now we're getting a second wave of the pandemic. Then we're also gradually inching towards Thanksgiving. If you put all of that together, do you see, do you get any sense of hope coming from the authorities and over there?
Well, you know, public health officials are trying their best to provide some guidance, and they're asking people to get their flu shots this season as well. But you obviously have people that are afraid of that, because then you would hear, you know, different reports and studies that come out that say you could potentially become more susceptible to the virus. So I think people are trying to figure out what is their best scenario for their health at this point, because as you said, the flu season is right here upon us, and the Thanksgiving season, which is a very family-centric time of year in the United States. And so people will have to make some tough decisions on whether or not they will gather as a family, because it's been stated, as we saw in the summer, you know, small gatherings, family gatherings is where the virus was spreading at rapid rates. And so potentially having to hold back on some of those traditional Thanksgiving activities could be the plight for many families in the United States.
Thank you very much, our Washington correspondent, Maria Bird. Do stay safe, and we'll get back to you real soon.
Thank you.
And the United Kingdom has recorded more than 6,000 coronavirus infections in the last 24 hours, a significant rise from yesterday's, which was nearly 5,000. This comes as the government announces new rules in a bid to curb the rising numbers of infections, which the government has defended as balanced, targeted, and unproportionate. Now, here's the global update.
Have you new regulations gone far enough, Prime Minister?
The British Prime Minister has announced a massive package to protect jobs and indicated he will be looking at creative ways to do more. He says the government is also going to come forward with more measures, though he ruled out a simple extension of the existing furlough scheme.
Very difficult circumstances, and that's why we've put in the support that we have. That's why there's don't forget there's the job retention bonus at the end of the year to help people, to help firms to keep people.
In Spain, hospitals are under pressure from the number of people being admitted. More than 10,600 people are presently in hospital with COVID-19, 1,348 of them in intensive care. Coronavirus patients occupied nearly 10% of all hospital capacity across the country, but in hard-hit regions like Madrid, that share is as high as 25.5% as doctors complain of a lack of staff and resources. Passengers returning from France have been added to the list of those travelers who need to be tested for the coronavirus at Rome's Fiumicino airport. The rapid 30-minute test will now be compulsory for those traveling from Auvergne-Rhône-Alpes, Corsica, Hauts-de-France, Nouvelle-Aquitaine, Occitanie, Provence-Alpes-Côte d'Azur, and Ile-de-France, the region that includes Paris. Belgium has decided to reduce the quarantine period for people with coronavirus symptoms from 14 days to 7. It's one of a number of new measures for the country, announced by the Belgian Prime Minister Sophie Wilms. The new quarantine rule will apply from October. The German Foreign Minister Heiko Maas is in quarantine after a member of his security team tested positive for the coronavirus. An initial test on Mr. Haas was negative for the virus, but the Foreign Ministry said in a statement today that would remain in isolation as a precaution. Finally, New Zealand has announced face masks are no longer mandatory in most parts of the country as COVID-19 cases continue to drop. From midnight of Wednesday, masks ceased to be compulsory in Auckland, the heart of a recent outbreak, except on public transport and planes. The rest of New Zealand lifted all pandemic restrictions on Monday after recording no cases for a week.
Across town as I've been visiting different sites, the usage has been.
And that's our package on COVID-19 updates program for tonight. You can take a closer look at some of the COVID-19 global numbers in real time. Visit our website, channelstv.com, and you'll get more updates and better understanding of what you need to do to stay safe during the period. And of course, there are other stories in politics, business, and sport. So join us for a fresh package of the program tomorrow. Thank you very much for watching. I'm Neota Igbe, and have yourself a good night.